we are going to see cranial nerves. So there are 12 pairs of cranial nerves. 12 pairs of cranial nerves. Okay. They have got different functions. Some are sensory, some are motor, some are both. Some have parasympathetic component. And they are mainly seen in the head and neck region. But one of it can go up to the large intestine, that is vagus nerve. Some are very long, some are very short. Okay, some are very thin as well, like trochlear nerve. And before going to cranial nerves, we need to know something called functional components. Actually, this topic is coming in neuroanatomy, but still it will be good if you understand now. So let's begin. Now, when we say functional components of cranial nerve, it has got two components or two parts, you can say. Afferent part, that is sensory. Efferent part, that is motor. So afferent for A, sensory, E for motor. Now when we look at this afferent component, it has got again subdivisions. Like you can see here, a somatic component and a visceral component. Now what do you mean by that? Somatic component is a component that is related or that is dealing with the body wall. Whereas visceral component is related to the viscera, that means internal organs. Now again, under somatic division, there is again subdivisions called general somatic, special somatic. You will see what is general somatic and what is special somatic. Similarly, when we see the visceral component, again it has got same type of subdivision: general visceral, special visceral. Now what do you mean by this actually? What are these? What are general visceral? What do you mean by special visceral? General somatic, special somatic. That's what we are going to see now. Now when we say general somatic afferent, which is represented here as GSA, which carries general somatic sensations like pain, touch, temperature, vibration, pressure, and also proprioceptive sensation, that is joint sense, that's from muscles and joints. So all these sensations are included in general somatic afferent sensations. General somatic afferent. When we say general visceral afferent, first we will see general, okay, of both sides. General visceral afferent, it means it takes sensations from the viscera, and they are general sensations from viscera. Now what do you mean by general visceral sensation from the viscera? So one of the viscera is stomach. So general sensation that is coming from the stomach is distension of the stomach. Okay, distension. So a pain in the stomach. These are general sensations which are coming from the viscera. So this is belonging to general visceral afferent component. Not only stomach, any viscera. It can be intestines. Okay. Now the next component is special somatic afferent. Special somatic afferent. Now we are in the special. Now these fibers or these are carrying special sensation such as vision, hearing, equilibrium. These are the sensations which are carried or which are considered as special somatic afferent. Okay, special somatic afferent. So vision, it's a special somatic sensation. Hearing, again, it's a special somatic sensation. Now, when we say that these are somatic, special somatic afferent sensations, it has one more meaning. Okay, that we will see later. Okay, not now, not to get confused. We will not see now. We will see that later. But for the time being, remember that special somatic afferent sensations are vision, hearing, equilibrium. Now the next component is here, special visceral afferent. These are another sensations like sense of smell and taste. So smell and taste, these two sensations are referred to as special visceral afferent sensations. So you need to remember here at least this one thing so that you can remember the other one. special visceral afferent. That means sensations are smell and taste. So we have seen that afferent component has got two major division: somatic division and visceral division. Somatic means it is the body wall. Okay, body wall. General, under this you have general visceral, general special. Under visceral, viscera means it's coming from the viscera, general, and the special subdivisions. Now we need to look at the cranial nerves which are having these components. So remember, I said cranial nerves can have a sensory component, or that means a purely sensory nerve, only sensory nerve. Some of the cranial nerves are only motor nerves. Some of them are sensory and motor mixed one. Some of them have parasympathetic component also, because we know parasympathetic flow is craniosacral. So some of the parasympathetic fibers will pass through the cranial nerves, and we already know which cranial nerves are there, which cranial nerves takes the parasympathetic outflow. We have seen it already, right? I hope you remember that. Only fools go wandering. That means oculomotor nerve, oculomotor nerve, facial nerve, right? Glossopharyngeal nerve, vagus nerve. These nerves are the one which are going to take the parasympathetic fibers, if you remember that class. Anyway, coming back to this topic, cranial nerves with afferent or sensory fibers are these cranial nerves are having cranial sensory component in it. They are cranial nerve 1, that is olfactory nerve, which carries smell sensation. This one, that means it has special visceral afferent component. Optic nerve, which takes vision, second cranial nerve. So it has this component, special somatic afferent component. Fifth one, trigeminal nerve. Trigeminal nerve usually takes different sensations. Okay, different sensations, general sensation, sometimes special sensations also. Seventh one is facial nerve. Eighth, vestibulocochlear nerve, which is related to the ear. Ninth one, glossopharyngeal nerve. And 10th one, vagus nerve. All these cranial nerves are having sensory component in it. But when we look at these cranial nerves, it may have a motor component also. So to differentiate that, we can say that cranial nerve 1 to 8, they are pure sensory. They don't have any motor component. They are only sensory. What are they? They are olfactory, optic nerve, vestibulocochlear nerve. So it is very important to remember now the names of the cranial nerves. Okay, so you need to know that exactly. So the pure sensory nerves are olfactory, optic, then vestibulocochlear. Whereas the mixed cranial nerves, which have a motor component also along with sensory component, they are trigeminal nerve, facial nerve, glossopharyngeal nerve, vagus nerve. These can have a mixed group of fibers. Now, there are some other cranial nerves or the same cranial nerves in that they have special sensations. Special sensations. They are olfactory. Yes, olfactory carries special sensation. Now, what is that? That is smell. Optic, again, the vision. Facial nerve. Facial nerve carries some special sensation that is regarding the taste. That we'll see later. All of these things we'll see later. Eighth, vestibulocochlear. It carries special sensation that is hearing and equilibrium. Vestibulocochlear. Ninth, glossopharyngeal. This again carries taste sensation. 10th is vagus. Vagus also carries taste sensations. So these are the cranial nerves which has the sensory component which is of special type. So special sense carrying cranial nerves. So you need to spend some time on this and understand it clearly. So these are the afferent component of the cranial nerves which we have seen in detail. Now coming to the next, that is motor component of the cranial nerves. I'm talking about all the cranial nerves here. Okay, this is efferent component or motor component. Now what do you mean by this efferent component or motor component?